Hello, I'm Dr. Robin.
And I'm Dr. Dana.
We are a married team of board certified anesthesiologists.
We practice at a women's hospital, and our anesthesia practice focuses mainly on labor and delivery patients.
Our main motivation for making this video is the number of young women we've seen who, when they come in for especially for their first baby, are just scared to death of having an epidural. And there's really no reason for that. In experienced hands, it's an extremely safe procedure. Many of these young women have been watching things on TV or the internet, or have been speaking to a well-meaning friend who's told them horror stories.
We want to explain how an epidural is placed and how it works so that if you're coming in to have your baby and you're interested in a labor epidural, that you will want to have one and not be scared about it, and that you'll have a very good experience and it will take care of your pain, alleviate that pain during labor.
I was looking at your chart. Looks like you're pretty healthy. No trouble with your heart or lungs or any
Nothing.
trouble like that.
No.
Are you allergic to any drugs?
Penicillin or erythromycin.
Okay, I'll make sure you don't get any of those today.
Okay.
And you had an epidural once before, right?
I did.
Any trouble with it?
No, it was great.
Okay. Well, then I'll do basically the same thing that was done last time. I'm going to clean off your back. I'll inject numbing medicine right about here. That part stings for just a few seconds. The rest of what I do usually doesn't hurt. Might hurt just a little. I'll put in the epidural. I'll hook it up to this little pump up here so the drugs pump in continuously. That should keep you pretty comfortable, but there still could be some pain along the way. The risk of you having any major complications from this is very small. Headache, backache, and nausea are the common side effects. The risk of a nerve injury is about 1 in 10,000. It's usually something pretty minor if it does happen, and it usually resolves on its own. And that's really all I have to tell you about the epidural. Would you like to ask me any questions?
No, I'm good.
Okay.
Thank you.
You're welcome. I'll get going now. Okay, I'm ready to get started. It takes a little while to get all my kit together to do what needs to be done.
Are you going to tell me before you start?
Yes, ma'am. Absolutely.
Does my husband need to sit down?
No,
Probably so. It'd be bad if we caught him on video falling over.
you just hear it. I actually did.
Just hear it? Okay. I'm going to clean off your back. This will be cold.
Okay.
Okay, if you're ready, I'm ready to get started. Are you ready?
Yeah.
Okay. This part will sting for just a few seconds on the count of 3. 1, 2, 3. This is the worst part. This is the numbing medicine. Okay, there'll be another little sting. It'll be deeper this time. Okay, you should just feel pressure. Doing okay?
Yeah.
Okay, I have the needle in place. I'm going to put in some medicine now. This will feel achy in your low back. Tell me if it's in the middle or off to one side. Did you say middle? Okay, perfect. Next, I'm going to put in the epidural catheter. As that goes in, you could feel a twinge of pain down one of your legs, similar to hitting your funny bone. If you do feel that, let me know which side.
Okay.
Okay, here it goes. Doing all right?
Yes, sir. It was light down the right side. It wasn't bad.
Down the right?
Yeah,
Okay.
that's fine.
Torque it back to the left a little.
It's really slight.
Okay, you can sit up. I won't do anything else to you that hurts.
How many more contractions will I feel?
I only have 2 or 3 more full strength contractions, and then they'll start getting easier. They'll slowly fade out.
Okay.
Just test those.
Okay. Pulse is 94.
Thank you. So how you doing?
I'm doing fine.
Okay. Not too bad?
Nope.
All right. All I have to do now is tape this thing to your bag. And we'll be done.
Okay. My feet are starting to get tingly.
Good. That's a good sign. That means it's starting to work. So how you doing, Dad?
Things are good.
You survived?
I survived.
All right, perfect.
Trooper.
I tape it very securely to make sure it doesn't come out. It's very rare for one of them to come out. Right, and this is what we end up with, just the taped up catheter. And right here you can see that little bitty tube right there. That is the catheter right there. Now I'm going to hook up the epidural infusion so it'll run in continuously and keep you comfortable. So how you feeling now?
I feel really good. My legs are nice and warm and tingly.
Good, warm and tingly legs.
Up to about my mid-thighs.
All right, that means it's starting to work. You feel like it's pretty even?
Yes, sir.
On both sides? Okay, the pump's all programmed. It'll run continuously now until the baby's born. Should keep you comfortable. If you do have some pain, this is the button you can push for extra drugs. Make sure the nurse helps you so you'll know what position to be in when you push it because it's affected by gravity.
Okay.
Like if you're hurting down low in the middle, you'd want to be sitting up. If you're hurting over on the side, you'd want to lie on that side.
Okay.
And it's okay if you're more numb on one side than the other. That's really normal during an epidural. As long as you're not hurting, that's fine. Once the baby's born, one of the nurses will take out the epidural and wear it off over about 2 or 3 hours.
Very
That's all I have to tell you unless you have questions.
good. Thank you very much.
You're welcome. You look like you're happy now.
Yeah, I'm comfortable.
Okay, good deal.
Thank you.